Hello, everybody. Welcome to the ALS United Mid-Atlantic Goals podcast. I'm Tony Heil with ALS United Mid-Atlantic, and we've been running this podcast for a number of weeks now to educate people about the various perspectives when it comes to ALS. If you've listened to our past episodes, and I hope you have, you can always go back to listen to them again. We've had people who are living with ALS on this podcast, caregivers, people who've lost someone to ALS, neurologists and doctors, and people who are experts in care. We've even had people who do research and people who are outside of ALS to talk about how we can work together to advocate for things like greater funding for research at a federal level or better caregiving. Today, I'm really excited to talk to my friend Courtney. I'm going to assume we're friends. We're going to be best friends at the end of this. Maybe just good friends. We'll see about that. Courtney is at Lehigh Valley Health Network, and we've had an ALS United Treatment Center there for many years now. It started a long time ago, and we have grown significantly with now Dr. Walsh and Dr. Romano. And we recently had on our podcast Jesse Meyer, a social worker from ALS United Mid-Atlantic, who is frequently at this clinic and helps our patients there. Courtney is a genetic counselor, and we're going to talk about what that means. We're going to talk about what her job is like day to day, how it's changed over the years, and how a genetic counselor can help people with ALS, and I imagine not even just people with familial ALS, and answer a lot of your questions, because most people, when they are experiencing ALS, they haven't really been thinking about this idea, and it might be scary, it might be something that's helpful, and I encourage you also to go back and listen to the episode we did on Huntington's disease, because maybe we'll talk about some of the differences or similarities in how a genetic counselor works with ALS versus maybe some other diseases. Courtney has a lot of experience, over a decade, in healthcare, variety of healthcare fields, but I'll let her talk about that because she knows herself better than I do. So, Courtney, thanks so much for talking today.
Yeah, thank you so much for having me on. I appreciate the opportunity always to get the message out about genetic counseling and testing. As you said, I've been a genetic counselor over 10 years. More recently, gotten into the field of neurology and ALS. So about a year and a half ago, I became the first genetic counselor in the Department of Neurology because the physicians there felt it was very important to add that role, especially in the ALS clinic. So I think the initial thought was for ALS, but I also do genetic counseling for other neurological conditions as well.
And I know you didn't necessarily start out your medical career in genetic counseling, right?
So I did start in genetic counseling, but there's different fields within that. So initially, I was doing more prenatal genetic counseling. So talking to couples who were pregnant and had concerns, with family history and passing things on to children. And then neurology is a kind of a newer branch, I would say, of genetic counseling. So that we kind of used to be pediatric, prenatal, and cancer, and now genetics really impacts all fields, and so now there are more opportunities and roles for us in really any setting.
Is that something that you had recognized as someone working in genetic counseling that, oh, there's this opportunity when it comes to neurology and genetic counseling? Or is it something where the clinic leads and others said, this is something we want and Courtney's great at it? Because I've seen it work both ways. So how did that merger happen for you and ALS?
Oh yeah, no, that's a great question. Well, I think just over time, as our technology has changed and the availability of genetic testing has expanded, we have found that the need in all of these areas. And then I was just looking for a new position, and this opportunity came up, and so I was really excited to kind of establish this role within our department.
So a lot of people might hear genetic counseling and what they think is you go into a doctor's office, they draw some blood and they say, here's your gene. And it takes like 3 minutes. I imagine your job is a lot more intense or detailed. Maybe not intense is the wrong word, but what exactly does your job look like when it comes to genetic counseling for a person experiencing ALS?
Right. Yeah, genetic counseling, that's a great question. It's really a process. So it's not just about the testing. So I think some people think if I have genetic counseling, I have to have the testing, and that's not necessarily the case. So it's really the process of us talking about the benefits and limitations in each person's situation, and then determining if genetic testing is something that makes sense for you and your family. So really just looking at pros and cons and considering things that maybe you hadn't thought about prior to the process. And so my day when I meet with a patient, I review family history, which is an important piece, and then talk about what we know about the condition and the genetics behind it. And again, pros and cons of the genetic testing, kind of getting into the nitty gritty because it's not always black and white or a yes or no answer. And then if the patient does decide to proceed with testing, those results do generally take about 2 to 3 weeks, sometimes more if we're doing more intense testing. And then touching back with them to go over those results. And so really just being with the patient through the entire process.
I remember years ago talking with one of our clinic leads, one of the neurologists, who talked about 30 years ago they didn't know any ALS genes, and now you can get your whole genome on your phone, is what they said. Now I don't know how accurate that is, but does the availability of data has that skyrocketed to make your job a lot easier to find things, whether it's you or the others working in genetics and ALS?
Absolutely. Yeah. As you said, this was not available, not that long ago. We didn't have a whole lot to go on. And actually, the C9ORF72 gene, which is one of the more common genes that we know of associated with ALS, wasn't found until over 10 years ago. So it's constantly changing and kind of expanding what we are able to do and how we're able to counsel patients about their potential risk.
So, what you said that there might be more intense counseling, that or the data might take longer. Again, I'm not an expert like you. I would think if I'm going in for genetic counseling, you're just going to say, "Oh, you probably have C9orf, or you probably have this other gene." Uh, how? Why would it take longer? What would be more challenging about getting the data within a week or 2 weeks or longer?
Great question. So for patients with ALS, we typically start with a panel of genes. We're not looking at the entire genome. We look at about 30 different genes that we know to be associated with ALS. And then in certain situations, if that is negative, but maybe there is a very strong family history, a very young age at diagnosis, something else that's still raising suspicion that there could be an underlying genetic cause, then we would move to more broader testing, looking at all of the genes to see if we are able to identify that.
And when people come to an ALS treatment center, like at Lehigh Valley Health Network, and they say, I've had two people in my family who had ALS, uh, but we don't know if they had a gene or what gene it would be. Are you looking for a specific gene when they see their symptoms? Like if someone comes in and they have foot drop, are you like, oh, it might be more likely to have this because of their age and their
Right.
symptoms? Or do you assume it could be any of the genes?
Great question. And we typically assume it could be any of the genes. There can be so much overlap and variability, even within the same gene or just within the diagnosis itself. So it would be difficult for us to pinpoint the gene just based on the symptoms. So we would. That's why we do the panel testing. Now
And then,
oh, sorry, go ahead.
okay, no, go ahead. No, finish. Sorry.
I was going to say for someone who comes and has the family history, but the affected individuals have not been tested yet, that can be a little more complicated. So we typically like to test someone who has the diagnosis first to see if the gene is in the family before we start testing other family members. If we test a person who's not affected and they're negative, we don't know if we tested for the right thing. Was there something else going on in the family? And so discussing all of that is part of the genetic counseling process as well.
And I know from talking with a few families who have even attended Lehigh Valley Health Network. My friend Karen Delaney, Scheidelev, her family had many people who either had ALS or they suspect they did. She said that I think she had this SOD1 gene, very public about it. And sadly, Karen passed away years ago. Larry is on our board here, very active, her father, in our work. And so when she comes in, they knew that they had a family history of people who had something that when they looked into it seemed like ALS. So they're like, because it was years ago. So they said, oh, we had an aunt who, had trouble speaking. We had this person who had trouble walking. Um, do you take that kind of history into account too? So they didn't get an ALS diagnosis, but you're kind of learning about other symptoms that people set off some alarm bells in the patient's mind of, hey, maybe the family had these other things.
Absolutely. There is a lot of overlap with ALS and other neurological conditions, like a form of dementia called frontotemporal dementia, sometimes Parkinson's. And so, when we look at the family history, we do ask questions about all of those things, not just the diagnosis of ALS. And in the family history, can look almost negative because of some of that discrepancy, or maybe there was misdiagnoses in the family previously. And so, yeah, we do ask a lot of those questions to see that if that could be contributing a contributing factor.
Now, I have ALS in my life. My grandfather passed away from
I'm
ALS
sorry.
in 2007. And as far as I know, he was the only one in the family that had ALS. My aunts and uncles haven't been diagnosed. My dad hasn't had it, but he's, in his early 70s. You never know with these conditions. Now, if I came to you and said, my grandfather had it, he was a veteran, which is considered a more likely to have ALS. So I think it's probably sporadic. Would you say, here's a reason to do genetic counseling, or, it's not really worth your time? And
Um,
that's probably not how you would say it to me, though.
Yeah, I think genetic counseling, of course, I think it's always, kind of worth time, maybe not the testing, but talking through the family. I think, having someone look at the family history with something like that, I would say, yeah, I'm not overly suspicious that there's, an underlying genetic cause here. We can never completely rule out that possibility because, again, our technology is always changing. We're identifying new genes that may be associated with these conditions. But certainly my level of suspicion would be low in that case. Especially if you have some knowledge about the other family members. So, sometimes a family history can appear negative, but maybe there's not a lot of information to go on, or there were individuals in the family that passed away early, and so maybe if they were going to develop those symptoms, we wouldn't have seen it. Things like that.
So when you present data to someone afterwards, how do you present that? What are you showing them? Is it like a spreadsheet of here's like I've seen like DNA image mapping and things of that nature. Where like, oh, here's these genes. Here's how this how it looks. Are you showing them a paper? Are you showing them like just a presentation? What are you giving them before I ask the next question?
Right. Yeah. I mean, so our initial discussion is kind of just some of the basics of genetics, genes and chromosomes, and talking about inheritance and what we know about that. But it is more of a discussion about the pros and cons. So not a lot of like a presentation, although I sometimes use some visual aids to assist with that. And then if we're talking about results, certainly I'll show them the result and then explain, exactly what that is showing.
And I think you alluded to the results aren't always conclusive, right? Either maybe you suspect there's a gene, but we've discovered genes in the last few years, so there always could be a new gene too. What kind of inconclusive results might you find from the counseling?
Yeah, great question. So, when we're doing the testing, we're looking for any genetic changes that we know to be associated with these conditions. But there can be changes that occur in a gene that are just normal variation. And sometimes we don't have enough evidence to say for certain whether a specific change is causing a problem or not. And we call that a variant of uncertain significance. So that is something that when that happens, we do have to kind of wait, and over time, as we collect more evidence, we will be able to reclassify that variant. Now, most of those changes end up not being disease causing, but again, there is that level of uncertainty that goes along with it. So that can be anxiety provoking, especially in, if we do testing in someone who is pre-symptomatic, and we don't know if there is a gene in the family or not. So then the question would be, was that the cause of their family member's ALS and now they are at risk, or is that unrelated?
I was talking with someone recently who said that there's certain genes, and gene mutations that are common between ALS and other diseases, right? So there's certain things that may present as ALS or maybe ALS and it's not as symptomatic as people can expect. It's a very complicated disease. Do you ever go through counseling and realize maybe this isn't ALS? Maybe you should talk to some other neurologist as well or another specialist because through our counseling we've learned some other things about your genetics that you could be helped in other ways.
Absolutely. And I think, as time goes on, we probably will get into the more comprehensive genetic testing for everyone. Although not common, at times we do find a different diagnosis for a patient. We typically do that more expanded testing when maybe, we think the diagnosis is ALS, but maybe there are some features that aren't quite fitting exactly with that diagnosis, and then we may identify something else.
I think a lot of people are afraid of getting their genes tested because they are worried about insurance. They're worried that they'll go and see Courtney, and Courtney will say, "Oh, it looks like you are predisposed not just to ALS but to some other disease," and that will set off an alarm to an insurance company. And now they don't want to know. They'll find out because I might, as someone in my 40s, go and find out that I am predisposed to some disease that I could get in my 70s, and I don't want an insurance company to know, right? How do you does that question come up, and how do you talk to someone about it?
Yeah, absolutely. That does come up a lot and is more concerning when we are testing prior to symptoms. So if someone already has a diagnosis of ALS, um, that doesn't, that would potentially affect not health insurance, but some of the other types of insurance. But if someone has no symptoms and they are considering pre-symptomatic testing, then we do typically recommend, if they are considering any type of life insurance, long-term disability insurance, that they look into that ahead of time. There are protections with your health insurance in the country. So there are laws that say that a health insurance company cannot use your genetic information against you. So nothing can change with your health insurance, but it doesn't apply to those other things like life insurance or long-term disability. Now, if you don't have symptoms and you have those things in place prior to testing, then nothing can change with them after the fact.
And I imagine it's also good, though, beyond insurance, to understand your genetics and if you're predisposed to ALS or something else, because there are still things you can do to maybe delay symptoms or help out. Because having a gene for any disease doesn't mean you're going to get it tomorrow. We know that smoking makes you more likely for everything. Smoking apparently is very bad for you. I don't know if you've heard that news. Maybe drinking, maybe other habits can make things worse in your body that make your symptoms worse when you do develop a disease. So is there a benefit to someone who thinks they might be predisposed to a disease to getting that information so they can treat their body differently to maybe help out later with a potential diagnosis of ALS or something like it?
Possibly, and I think we're still learning a lot in that area as far as things that we can do to prevent or lower that risk. But so at this time, there's no specific treatments or preventions. But of course, yeah, things like healthy diet, exercise, we know those types of things are always beneficial. So if someone thinks they might do things a little bit differently, if they know they're predisposed, then absolutely, So beyond prevention, there are some benefits, and maybe someone would make different decisions if they know there is a higher chance that they might develop something in terms of, career or travel, what they do financially. It can be helpful to know that. But I think everyone looks at that differently, and so there are some individuals who would not find that information helpful or would maybe have increased anxiety knowing that they have a gene that could predispose them to ALS. So that's where the genetic counseling is really important to work through each person's feelings on that before they make a final decision in consenting.
So speaking of feelings, you're a counselor, a genetic counselor. It's not different than a therapist. It's
Right.
different than other things.
Mhm.
Uh, there's a lot of your work in how you present that information and the emotional aspect of sharing that. When people come to you, I'm sure that they're already understanding of ALS to an extent, so you're not surprising them with a diagnosis. But is that some of your training, not just about the science, but about how to, counsel them and really talk to them in a way that's comforting?
Absolutely. Yeah. So part of our training is in the counseling, more of like a kind of a crisis counseling. We're not like long-term therapists type thing, but yeah, in just having people open up about how they feel or just thinking about things differently, just to help them kind of process the all of it.
One way that people can process a diagnosis of ALS is to be empowered through research. I've talked with researchers at different ALS treatment centers, and they often will have people who have a genetic form of ALS participate in research because they know they have ALS, they know some things about those genes. Is that something where if you've talked with someone with ALS and you have been able to help them understand their genetics, that they may be a good candidate to participate in a research study?
Possibly, yes, and that would be another reason to consider participation. And I think previously the focus has been on treatments and cures for those diagnosed, but as we're learning more, there are going to be more trials that are involving patients that are known to be at risk but haven't developed symptoms yet.
So it's possible that if you know in the future
Mhm.
that if through your research or your assistance with research that you find out that people who have the C9orf gene mutation, that there's a therapy that could stunt the growth of that those symptoms. That if someone at age 50 starts taking this therapy, they will either delay symptoms or they'll never experience symptoms, but they don't even need to get tested for ALS. We just know, like, oh, your family history has this gene, so we think you should take this drug or this therapy or do something. It's possible in the future you could say, Tony, your family has this gene history. We think that you should take X drug because you're going to delay ALS altogether. Is that something that's out of the realm of possibility?
No, no, that's absolutely within the realm. Currently, there is one gene therapy. Now, it's not for pre-symptomatic patients yet, but for the SOD1 gene, there is a kind of gene-specific therapy that it has been shown to delay, or I'm sorry, to slow the progression of that. So not necessarily prevention, but that is the goal, is to get to that point where we can identify the at-risk individuals and either prevent or slow the onset of the symptoms.
And I did talk with Rochelle Green. She's one of our previous podcast guest. She has the SOD1 gene and she is using that therapy. And she talked about her experiences with it, the trials in it. I encourage people to go on her YouTube page or find the podcast episode because she's said it's been very helpful for her. Obviously, therapies are individualized, so something might work for you and be better for. I'm not here to recommend therapies, but
Right.
when you see the stories of someone like her and that therapy for the SOD1 gene, is it like a roadmap saying, okay, if it works for this, it gives us an idea of what we can do, like getting Lego instructions. Like gives us an idea of how we can do it for other genes for ALS.
Absolutely, yes. Once we have that experience, where it allows us to learn more just in general, and get more specific with the other forms. And then, hopefully learning more about the genetic forms of ALS also helps us with treating, those that are not purely genetic as well.
Hmm. That's a question I had written down. I was so interested in what you're saying that I hadn't asked it yet. Because most people with ALS have what we call sporadic ALS. But is there anything you can learn through genetic counseling that might even be able to help people with sporadic ALS? Like maybe there's not an ALS gene, but something that shows you're predisposed to some other thing that makes ALS worse for you. I'm saying that as someone who's not an expert like you, but could you learn something from genetics, either now or in the future, that even for sporadic ALS can be helpful?
Right. So, I mean, we do offer the testing to everyone, because we know a certain percentage of those that it may appear sporadic, it still could potentially be genetic. There can be new mutations and, other things as far as like lack of family history that we discussed previously. Outside of that, we haven't really identified like other risk factor genes or other things from a genetic standpoint that could be helpful yet.
Well, I'm asking because, like, I'm not an expert
Yeah,
like you, but
sure.
could you find in the process of genetic counseling that, oh, through your genetics, we know that you don't have this other disease, but you may be more predisposed to having some breathing issues, and that's a big symptom for ALS. Or maybe we can tell from these other genes we found that you could have this other thing, and that's going to impact your speech or your bones or something. So you're going to need like a cocktail of therapies and support later on because ALS is really hard on these conditions. And so we understood this other thing about you that we can help with better overall care.
So I don't think we're there quite yet, but sounds a little bit more like kind of like personalized medicine, which is certainly an active area of research. But as far as now, we tend to do the testing very specific to the symptoms and family history. We're not able to just broadly look and find other things that we may not have been suspecting. Um, yeah.
But it's really exciting to see what you guys are able to do. And part of the reason you're able to do it is because you have such a well respected ALS treatment center at Lehigh Valley Health Network. It's grown since Dr. Mackin started it years ago. You have Dr. Walsh and Dr. Romano and a whole team there that's really created a wonderful reputation for care and now research in the Lehigh Valley. I want to hear from your perspective working there. You would want people to know about that treatment center and the kind of care and research that they can see at Lehigh Valley Health Network.
Yeah, I'm so proud to be a member of this team. Obviously I'm later to the team, but it has been a wonderful experience. We all really work together to provide, the best care that we can. And every member of the team just really truly cares about the patient and, is there to provide them with whatever services we can to help them, not just them, but also support their families through the entire process. So we really do amazing things through the clinic, and I think it's very beneficial for all of our patients, and I hope they feel the same.
I can tell how much you guys cared because I saw you at the ALS United Walk in Lehigh Valley. I saw Dr. Walsh there as well. I saw many other people from your team who were at the Lehigh Valley ALS United Walk. So tell us about your experience at that walk and what it means to be connected to an organization like ALS United.
Yeah, it was great experience because it was us, and we brought some of our families. I had my daughter there, just to kind of all come together in support of each other and our patients. It was great. I had the opportunity to meet you and some other individuals that I hadn't yet, and so it's really important for us to contribute in other ways outside of the clinic, also.
I appreciate that because I know you are great with science and you are really great at your job, but the best way to do your job is to have that connection. I think for people with ALS, I imagine when they come to you and they must know, it must weigh on their shoulders that they have a potential family history, and having someone like you put them at ease. uh, helps them with the trust to keep coming back. You probably have, as a result, people who want to keep coming back to the clinic because you've established that relationship and that trust, and genetic counseling can help with that, right?
Absolutely, yeah, and like working with the patients, and then if there is, if we do find a genetic cause, working with all of the family members, if there's children who are at risk, so it really becomes just a family issue that we work through, and yeah, I hope I'm there to support each family member in their own journey through that whole process.
Wonderful. Well, let's finish up here. I just want to ask you one last question. Because of your experience with genetic counseling and the growth in the science and what we understand about genetics and ALS and new genes, what gives you hope for the future of ALS and genetic therapies?
Yeah, I think obviously we have learned so much over the past, and we still have so much more to learn. But I really think we're on a path where eventually we can offer even more hope to patients through better treatments and eventually prevention and a cure.
Well, thank you so much, Courtney. I know that we're on the path to those better treatments because of people like you, Dr. Walsh, Dr. Romano, and all of our experts that we partner with here at ALS United Mid-Atlantic. If you want to learn more about Courtney's work and about our clinics, you can visit our website at www.alsmidatlantic.org. We'll put the description and link to your work in the description here so people can find you and learn more. Again, follow us on social media at ALS so you can follow along for any news and updates. And of course, subscribe, leave your comments, share it because it helps us create more ALS awareness and have conversations like this to educate you about topics like genetic therapy, genetic counseling, and how we're going to find new treatments to end ALS. Courtney, thanks so much. I'm really excited to work with you for the next few months and years so we can advance the science and help people living with ALS and their families.
Thank you so much for having me, and I feel the same.
Great. You have a good day. And again, please like and subscribe. And I appreciate you being here as we work together to end ALS. Hi, everyone. It's time for a bonus question with Courtney about genetic counseling and ALS because I forgot to ask her about her time at the Northeast Amyotrophic Lateral Sclerosis Consortium, or NEALS. She was just there with the team from Lehigh Valley Health Network, connecting with ALS leaders from around the world, around the country. I know we had some other people from ALS United there. So, Courtney, what was your experience like at NEALS?
Yeah, it was amazing. It was my first time there, but just to see the amount of research and all of these individuals that are so invested in getting more information, learning about the condition, it was really amazing. And then kind of outside the actual specific talks, it was great to be able to connect with these individuals and learn more from them, even on an individual basis. A number of genetic counselors, we got together for a lunch, and I even learned some tidbits just during that discussion. So it was really a great experience and great to network with the individuals that are involved in all of the research.
So my coworker just had a T-shirt that said "Talk nerdy to me." When you're with the other genetic counselors from all over the place, are you all just talking about TDP 43 and C9 ORF, and the waitress is at the table, just like I just want to get your drink order?
Not exactly like that, but yeah, there's definitely some of that talk. And then, just some other thing, little tricks of the trade that I was able to learn as well.
And when you hear from these other people who are doing genetic counseling or other topics that they brought up at Neil's, you bring things back to the clinic now and say, oh, now I should consider this, or here's something we should think about for the next 2 to 5 years?
Yes, I think I overheard some talk yesterday during our clinic about some of the things that I'm not completely aware of, but things with some of the breathing treatments and the nutritionist. I know that they learned some things that they might consider doing differently now.
Thanks so much, Courtney. I'm excited that you had a great time at Neil's, and I'm really happy that we're able to have such experts from our area go down to a big conference like that and show that ALS United Mid-Atlantic has the best experts anywhere in the country when it comes to taking care of ALS and research as well. So thank you so much, Courtney.
Thank you.